today.
Well, kia ora koutou katoa. Welcome back to Manatū Hauora, the Ministry of Health, and thank you for making the trip up the road. It's a beautiful day, so hopefully you enjoyed adding to your steps for the day. Now, there are 9 new confirmed cases of COVID-19 to report today. All are in the community, and there are no new cases in managed isolation facilities from travellers coming across the border. 7 of the new cases have already been linked to previous cases in the cluster, and we have a total of 4 cases that remain under investigation, including 2 of the new ones, which have arrived very recently into the database. Based on the information available so far, they are all believed to be linked to that same community cluster. Now, as of 6 o'clock last evening, 86 people linked to the cluster have been moved into a quarantine facility. That includes 36 people who have tested positive and household contacts. There are 5 people receiving hospital-level care for COVID-19 currently. 2 are in Auckland City Hospital on wards, and 3 are in Middlemore Hospital also on wards. The 3 people in Middlemore had been transferred from the Jet Park facility, and all are people who are connected to the cluster. So the 9 new confirmed cases today bring our total number of cases to 1,280. That is our total number of confirmed cases. And the total number of active cases is 78, of which 58 are our cases that relate to this community cluster, and 20 are imported cases that are in managed isolation, actually in our quarantine facility. Moving on to testing, we're continuing to see record levels of testing, and our labs are continuing to meet the demand for levels we have not previously seen before or processed. And yesterday, our laboratories around the country processed 26,014 tests for COVID-19. So the total number of tests completed since the start of the pandemic in New Zealand is 597,956, of which almost 100,000 have been completed in the last week or so. Now, as previously reported, because of the high volumes, there can be delays in processing at the labs of up to 48 hours, but the labs continue to prioritise the tests that are from people who might be at higher risk of returning a positive result, that is close contacts or others who have had contact with one of the existing cases. And just a reminder, only people who have symptoms should be seeking advice and or presenting for testing, so we can ensure that all the swabs are processed as quickly as possible, which helps us define and contain the outbreak. So testing at the border for workforce at both airports and ports has continued to increase. There's a dedicated testing team with extended hours now at the ports of Auckland to ensure good access to testing there for the workforce. There is also testing of all government agency frontline staff at the Auckland border, Customs, Biosecurity, Immigration New Zealand and Aviation Security, all either complete or about to be completed. There's a new team that's gone into the Tauranga port just this afternoon, and over the next few days that will be supplemented with additional testing people, so they will be able to test several thousand workers at the port of Tauranga over the next few days. We're also continuing to test staff working in managed isolation and quarantine facilities around the country, and in Auckland where more than 2,500 staff work, over 2,100 had already been swabbed on site, and by the end of yesterday, and of course quite a number will have also been tested by their GP or at CBACs. Just a word on casual contacts, and understandably there is a significant interest and in some cases some anxiety around casual contact tracing activity from organisations or locations where cases may have been for a shorter or longer period. Now, our contact tracing processes do involve in-depth interviews, often more than once, usually more than once, with confirmed cases to get a full picture of anyone that they may have been in close contact with, and likewise other places they may have been, just to help with our casual contact tracing. Now, many of the reports in the media are of organisations or locations being closed due to positive cases having been at that location for a period. However, in most of these instances, the people who were there at the same time are simply casual contacts, and all they need to do at this point is to monitor their health and get advice from GP or Healthline if they become unwell. Some casual contacts, depending on the situation, may be asked to be tested, and they will be asked to be isolated or self-isolate until the test results come back. We've been using the COVID Tracer app to contact or notify people in some of those relevant locations and times when they have scanned in. And I've asked the team to also publish those location and time details on our website. So some locations of interest over the last 2 days are the Botany Mall between 1 and 2 p.m. on the 11th of August, Butterbean Motivation between 5:15 and 6 a.m. on the 10th of August. That's a fitness class at School Road in Kingsland. The Eden Junior Rugby Club in Gribblehurst Park, Sandringham, between 5:30 and 6:30 p.m. on the 11th of August, and also a guinea pig show at the Auckland Cavvy Club in Hall Road between 10 a.m. and 2 p.m. on the 8th of August. The important note here is that the risk from these locations is invariably very low, so people should not feel the need to avoid those areas or organisations. This is just simply of us casting a wide net and making sure that anyone who might have been in those locations is aware and to be aware of symptoms. On to the NZ COVID Tracer app, which has now recorded 1,442,300 registered users. That's an increase of just over 68,000 in the last 24 hours. There are now 210,266 QR codes generated, an increase of over 16,000 in the last 24 hours. And in the last 24 hours, there were 833,020 poster scans undertaken, and the total number of poster scans is now over 6.2 million. So great to see New Zealanders not only registering with the app, so we have their up-to-date contact details, but also using it. Just moving on to the testing, the environmental testing at the Mount Wellington Americold facilities. The swabs were taken over the weekend and flown to ESR here in Wellington for testing. It will take some time to process all those swabs. There is a number, and it's quite a sophisticated and indeed novel process for this virus. We need all those tests to be completed to get a full picture, and they are expected during the week. We will, of course, outline those results as soon as they're aware. I should say that even if some of those swabs return a positive test, the challenge will be in determining the direction of any contamination that might have occurred, and it may be difficult to get any RNA material that will be from those environmental swabs, which can then be genome sequencing, but obviously that is the aim if we possibly can. On a related note, supermarkets have said that some customers are concerned about frozen goods, and a reminder that the New Zealand Food Safety team has reviewed the most recent science from around the world on being infected with COVID-19 through contact with food and food packaging, and there's no evidence of transmission via food or food packaging to date. And remembering that those goods that come through Americold have a number of other layers outside them, in addition to the packaging of the actual food. And of course, I need to give a plug for normal hygiene procedures, so frequent and effective hand washing and use of alcohol-based hand gels before preparing food is of course ideal and recommended. So finally, just to reiterate the point I've been making, this is a tricky virus. The virus is the problem, not people. We are all collectively the solution, and it's been heartening, very heartening to see the number of people coming forward to be tested. And those who have tested positive are to be commended on the fact that not only did they come forward, but they then have assisted in detailed follow-up so that we can find where this outbreak is and ring-fence it. And I'm certainly wanting to commend them for their actions, and I think they deserve nothing less than our thanks and praise. I'm happy to take questions.
Dr. Bloomfield, last week the Prime Minister said that there was regular testing at ordered and managed isolation facilities. However, by your and the Health Minister's own omission, that wasn't taking place. Did you mislead the Prime Minister or Cabinet about this?
No one was misled. What I would say is that there was testing happening at our managed isolation and quarantine facilities around the country. It was rolling out and scaling up. And just to put that in perspective, and I've said this several times, including I think last week, there are 32 managed isolation facilities with a large number of staff, and we were working up how to ensure that all the staff there were tested, including the hotel staff as well as those on secondment, remembering that they are working shifts. Some of those staff were also being tested in the community. For example, Defence Force staff at Linton and Ohakia were being tested once they had gone back off their shifts. So it was rolling out. We were increasing the frequency of that testing. But just to reiterate, there was testing happening, and at the same time we were also rolling it out for our staff at the airports and at our 17 ports around the country, but not all of that testing could happen at once, so it was scaling up.
But the Prime Minister's clear expectation was that was already happening, and what you're telling us today that it was being rolling out. So where's the miscommunication there? Why was she and Cabinet thinking that it was already taking place, whereas you're telling us today that it was actually a process leading up to that point?
Well, just to affirm the point I made, actually testing was happening, and if we go back and look at our managed isolation facilities, they had all had some testing happening. What was scaling up was the size of the teams and the frequency with which they could go back into each facility, and that was taking some time, remembering this was being done under Alert Level 1, where our health system is providing care right across the spectrum for New Zealanders. I can say that we were working very closely with the DHBs in Auckland, as well as in Canterbury and here in Wellington, to make sure that the testing was being ramped up to test everybody. And at the same time, and I want to make this point too, this was an adjunct to a number of other things we were doing, including independent infection prevention control audits of the facilities, and we had introduced a number of new measures like masks for all guests from plane to room when they first arrived, and much wider use of masks in the facilities.
Some people are waiting up
to 5 days to get their test results. Is that good enough?
Look, it is a pity that people are having to wait that long, but I just want to reiterate the points I've made in the last couple of days. Is it can take 48 hours for that lab turnaround. If the result is positive, there is immediate action, and the tests that are more likely to be positive are prioritised. I know that it can be a nervous wait for people, and I do want to acknowledge that, but you'll see from the volumes, which are really, really high, that our labs are doing a fantastic job of processing a lot of swabs. I apologise for the wait in getting the results back for some people, but rest assured, if the result was positive, they would hear very, very quickly.
Is the test results a wide-scale problem that you're aware of, and you know where it's happening most?
I don't know. I suspect there may have been slightly longer delays over the weekend because many general practices are shut, and often it's the general practice that then passes the information through. So my expectation would be that over coming days that wait will drop. If there are specific reports, we will follow up directly with the lab and the DHB to see what can be done to expedite getting the return of results.
Do you accept that second testing policy wasn't implemented as it should have been under your watch?
It was being implemented, and as I say, this was quite extensive testing across a number of sites, a number of workforces. It requires a lot of coordination with ourselves, with those in charge of the managed isolation facilities, those in charge of a range of workforces at the airports. What I can say is that the Minister was very clear that they wanted that testing to roll out as quickly as possible, and we were working with the DHBs and very focused on making sure that happened.
Did you communicate that it wasn't happening?
We were giving the Minister and Cabinet very regular updates on the extent of that, and based on our updates, again, they were making sure on a very regular basis that we were quite clear about the imperative to get the testing scaled up as quickly as possible for our border workers as one part of continuing to strengthen our border measures.
Prime Minister's understanding, though, was that the policy had been rolled out as expected. Did you check to see that it was happening?
I was checking every single day, and there was clearly a dissonance between what the Prime Minister thought was happening and what was happening on the ground. But that doesn't mean we weren't providing full information through. So it may be in the way the information was communicated. I think what we've seen over the last few days, remembering again that this is in response to an outbreak, we have seen border workers actually instructed under an order to be tested. I think the other thing I would say is that there was testing happening right across our managed isolation quarantine facilities and also at the airports. But remembering we were in alert level 1, the testing was voluntary, and like other New Zealanders, many of our workers in those settings didn't necessarily feel that there was a need or an imperative to get a test, particularly because every day when they turned up to work, they were being checked for symptoms, including temperatures being taken and so on. So this was another adjunct. Work was happening with unions and others just to increase the uptake of the testing. We're now in a situation with the outbreak where there's a specific order requiring them to be tested, and as you can see, they're coming forward and being very cooperative.
Should that order already have been in place right from the beginning?
Well, at the point in time, remember again, we were under alert level 1. And at that point in time, we were going through a process of scaling up the testing availability, working with unions, ensuring that we knew who all the workforces were, who were rotating in and out in different roles, making sure we had that information, and ensuring that even those on night shifts or who were off duty could get in for testing as well. And again, some of that testing we know was happening with general practices, not necessarily at the facilities. It's only now that we have got coding in the labs that will be able to tell us exactly who from those managed isolation facilities has actually been tested.
On a June 23rd press release, the Minister of the Health at the time said regular health checks on and asymptomatic testing on all border-facing workers would be underway. Why would it take so long between now and then to actually get it up and running when we've seen over the weekend that the Minister has implemented it and it's taking place over 72 hours?
Look, I just want to take you back to the whole country, and we know, was operating in an alert level 1 setting. That didn't mean that our border facilities have been at alert level 1. We have been running these incredibly tightly since the 9th of April and put in place a number of strengthening measures since that time. This was another one we were putting in place. We had also put in place the regular testing day 3 and day 12 for all guests there. So again, just think about this as part of the suite of actions that were underway, but we couldn't suddenly flick a switch and test all members of that workforce overnight. We were keeping the Minister and Cabinet very regularly updated on progress with rolling that out.
So they were being updated with progress. So on one hand, you've got the Prime Minister and the Minister of Health that thought that it was happening. Yep. On the other hand, you were updating them. So at the end of the day, was this just a miscommunication? Well,
I think the Prime Minister and Minister were making really clear what their expectation is. I certainly felt and communicated that expectation, and I know that our team and the DHB teams were working extremely hard to get that testing rolled out. And also we were working with our colleagues who are managing those managed isolation facilities as well to make sure the workforces were available so that they could be tested.
The problem here is that they were under the impression that regular testing was already happening, yet it wasn't happening. And you're saying you were scaling it up and ramping it up.
Yeah.
But why were they then under the impression that it was already in place?
Well, I'll just go back to the point I was making. There was testing happening in the facilities, absolutely.
That's not in dispute.
And what I'm trying to point out is the challenge and complexity of rolling that out so that it encompassed all of the workforces in all of those facilities, as well as at our ports and airports. And what I don't want to have leave anyone in any doubt is the fact that the teams were working incredibly hard to roll that out as quickly as possible.
That's not in dispute either. What's in dispute is they were under the impression that it was happening regularly. Not that it wasn't happening at all, just that it was happening regularly. So where is that?
Well, again, if we go back, most of those managed isolation facilities had teams in more than once. So what we were trying to do was, first of all, capture all the workforce and then increase the frequency of the testing so that it was every 2 to 3 weeks for every member of the workforce. And again, I just want to come back to the complexity here. And we were operating in an environment under alert level 1 where the testing was voluntary. So, look, I think I don't have anything more to say about that, but I just want to reiterate there was absolutely a lot of activity going on to ensure that all the workforces would be tested regularly.
But in your mind, there's been no failure here?
No, I don't think there's been a failure. I think that I know there's a desire to look for a point of failure here. Our border systems we have been continually strengthening. We have added in the testing of workforce, which was being scaled up as part of belt and braces. We have added in audits of infection prevention and control. We have added in the wider use of masks. We have got really clear procedures and protocols there.
The Health Minister has said that there has been a failure and he has accepted responsibility for that. You disagree? There have been
Well, I don't think he said there was a failure. I'm pretty sure because I was beside him.
Testing hasn't been done as he expected.
Yeah, I think that's right. And what I'm saying is that the expectation was that all border staff would be tested regularly, and that was what was being rolled out.
Do you accept responsibility for not meeting the Prime Minister's expectations?
Oh, look, I've talked about this with the Prime Minister and Minister of Health, and my sense is what they're really interested in is how we make sure that that testing does scale up and be available regularly for all border staff. At the moment, of course, we've got a huge workforce that is out there doing that as part of the response to the outbreak, and again they're working around the clock to make sure that happens. So I think I feel the keenness of their expectation and the responsibility that I have to make sure that ourselves and the district health boards, who are the operational arm of the health sector, deliver on what that expectation is.
But
investigating the supply chain from the Americold facility back through the ports and through the shipping workers and stuff like that. How's that investigation going? Is there any update on that?
I don't have an update on that sort of end-to-end investigation. There are a couple of things. I've mentioned the environmental swabbing from the facility in Mount Wellington. We're also expecting back to date today, I hope, the results of the testing of Melbourne-based workers who work in the Americold setting in Melbourne, or facility in Melbourne, and the lab there is doing the genomic sequencing there just to see whether it's a similar or a different pattern to the genome sequencing from the outbreak we have here. So that will be, again, another small piece in the puzzle that will help us possibly rule in and also possibly rule out whether there is a link there.
And is it still the main focus of the investigation?
Look, it's one focus. I wouldn't say it's the main one. We still don't have any particular clues as to what the origin of the outbreak is. Our first focus is on course on mapping the full extent of it and the full extent of infection, and then managing that outbreak. It will be, once we have that complete picture, we are much more likely to be able to then go back and trace the origin of it. And you know, it's somehow the virus has come in across the border. I think we're confident that it wasn't brewing away or a sort of a slow burning ember in the community. The question of where it's come across the border and how is what we're trying to answer, those two questions. We may find some clues as to where, but we may still never quite answer the question of how it was transmitted, but we'll do our best to do that.
Close to having the contours of the cluster?
Look, I think we're getting closer all the time. Again, if we look at the number of new cases today, given the extent of testing that has happened over the last few days, I think that's encouraging. And the fact that we've got 4 cases, yes, still under investigation, the genomic sequencing will help there. But the sense we have is that we are dealing at the moment with a single cluster, a single outbreak, and thanks to the efforts of the community in coming forward for that testing, we're getting, I think, a full idea, as you say, of the contours of the outbreak.
I've spoken to some workers at the ports who say they've been given conflicting advice about whether they can work or not until they've had their test results. What are the rules on that, and do you know why they would have been receiving conflicting advice?
I can't say whether they've been receiving conflicting advice. Can I just check, is this at one port in particular? Is it Ports of Auckland?
At the
Tauranga. I will check that, yes. The advice is, well, actually, there are sort of some members of the workforce who are at slightly higher risk, perhaps, of being exposed, like the pilots who go out to the ships and or stevedores who might have be more likely to have contact with the ship's crew. So there may be a differentiation in advice for those people compared with those who are much more casual, who may have just been driving trucks in and then out and not had any contact. But I can check that.
So the truck drivers, if they haven't received a negative test result yet, they can keep working?
I don't want to preempt what advice they have been given, but I'll definitely follow that up and make sure it's consistent.
Just in terms of that, Taranaki hapu Ngāti Rangi and some of the hapu in Te Kaitokero are planning on making regional bubbles. Is that something that you would encourage?
Well, At the moment, we've got the whole of Aotearoa outside of Auckland at level 2, and there's no particular reason at the moment to create regional bubbles or further boundaries, as it were, around specific regions. I know that some of those iwi, both there and elsewhere, and other communities have concerns, and I suggest that they, if they're not already, and I suspect they are, that they're talking with the local DHB and with those in central government who are leading some of those conversations with communities. Certainly at the moment, as we've just described, aside from the 2 cases in Tokoroa, there's nothing that has shown so far that there are any cases outside of that Auckland region. So that's encouraging, and I think that iwi should take some comfort from that.
From community cases, we've been hearing from people who are just wondering, when they go into quarantine, can you tell us who exactly will be going into quarantine? It seems from the data you provided today, there's about 2.4 people going into quarantine for every case that goes into quarantine. Is it entire families? Say if you're a single parent with 1 kid, is your kid coming to quarantine with you?
What we're generally trying to do is encourage, especially where it's helpful for families, is that the case and any close household contacts who might be at risk of still developing the infection or showing infection, that they go into quarantine. They're kept separate in the quarantine facility so that it absolutely reduces the risk of passing it on to other household family members or other household members. So that's why we see, so some of those will be just individual cases there, but others will be the whole family in there. And again, the main one of the key drivers of this is to protect the rest of the whānau members from that infection that's very common inside the household if there's not that isolation of the case or cases from other family members.
The Ministry right now, some people were asking, they're saying that the government's advice on masks is a little vague. The government's advice is you should wear a face covering when you're out and about. Does that mean, is that limited to public transit and stores? Does that mean you should wear it once you leave your door? If you're in a park, if you're on a beach, when should people be wearing masks?
Well, I always think of out and about as out from my house or my workplace and about in the community. So it's encouraged both indoors and outdoors. But of course, the main place is when you're in an indoor environment with people who aren't inside your work or household bubble.
So just on the house and your mask up.
That's right, yes.
Question.
In terms of testing at the port, that initial time frame was meant to be midnight tonight. So is that now redundant? Has it been extended? And how risky is the port in terms of allowing the virus in?
So a couple of questions in that. On the first one, been working with the Minister to extend the initial order, the time frame, because of the sheer numbers of workers that needed to be tested, and we've been working really well with the DHB and the ports, both Auckland and Tauranga, to get more testing capacity there, and also to prioritise the workers who should be tested first, and then others who are much lower risk a bit further down, a bit later in the week. So yes, we've extended the time frame there. There's no one's going to be penalised if they haven't had their test by later tonight. The ports is an area that there's been quite a lot of focus on already over the last few months, and in particular over the last 5 or 6 weeks, where there's been that specific order in place which has been preventing crew from disembarking vessels other than very close to the vessel as required for tying up and unloading and keeping that physical distancing from port workers. So I don't think it's necessarily a high risk way that the virus could get into the country, but it's part of our really trying to cast the net wide and find, is there potentially some risk of infection at the port? And
do you have revised figures on how many workers or people you think you need to test now for those ports?
Look, it's quite hard to get the denominator. It's several thousand. What I can say is that by 5 o'clock yesterday, there were well over 1,000 from Auckland Port and that had been tested, and maybe even higher. And in the ports of Tauranga, they will be able to get through 2,000 to 3,000 just over these coming few days.
Is that revised date now a specific time, or just as it comes up?
Actually, the order's with the Minister at the moment, and I can't remember the exact date, but that will be signed and published. So I don't want to steal his thunder there.
You've seen comments from the Ports Chief Executives Group spokesman Charles Finney, and he said that the ports have been trying to get tested and have repeatedly requested testing at the port as recently as 2 weeks ago, but haven't heard anything about it.
Yeah, there was testing at ports, not all ports, from several weeks ago, and starting with a number of ports. And again, Littleton, Auckland was one of the first ones, and again was rolling out around the country, starting with those that we thought might be at higher risk. So yes, that again was another site that we were rolling out testing, both of the government workforce, so the customs and other MPI staff, but also of those working in the ports. The challenge with ports is also that there's an enormous number of people that come and go into the port operation. So it's working out who are those who might be at higher risk and trying to focus regular testing on those groups.
It was sort of implied that their pleas were just being not heard.
Oh, well, I just have a different view from Charles on that one.
You mentioned that the
So we'll just go over here.
Yeah, thanks. Just sort of specifically around the testing, it was said that quarantine workers were being tested weekly, routinely. When did that begin?
Look, I don't have the exact date, but it was, we were moving to weekly for our quarantine workers because they were more likely to be, the testing had begun and was moving to weekly. And again, I'd have to go back and look at the dates there.
What, 2 weeks ago or 3 weeks ago?
I couldn't. I'd have to go back and look. What I can say is, and I've visited the quarantine facility, the Jet Park in Auckland, is that it's got the strictest protocols around infection prevention control, separation of people who are COVID positive from others. The staff there, as I said, have daily symptom checks when they go in, and any symptoms were being swabbed and have been for some time by the medical officer who's on site there.
So by that, are you saying you feel confident that if the virus emerged across the border, it didn't come from one of these quarantine facilities?
We simply don't know. What I can say, just to reiterate the point, is that we've had these arrangements in place since the 9th of April, and they've proven so far to be really good. And we have done nothing but strengthen them since, remembering that we added in the double testing of all people before they could depart. We've been adding in the testing of staff, but also the testing is only one thing. Even if we were testing everyone every 2 to 3 weeks, just a reminder that a number of these cases we have found in managed isolation and quarantine, the person's tested negative on day 3, but then positive on day 12. So the testing is one part, but by no means the main part of keeping both staff and their families and the community safe.
Just on the people in hospital, are they all in stable condition? Are some serious to be concerned factors like old age or anything like that?
All 5 are on the ward, and at this point the information I have is that all are stable.
You mentioned that the tests are being sent down from Auckland to Wellington in the Americal storage. Does that mean that the going theory right now, or the strongest theory, is that COVID-19 was brought into the country via this cool storage? Or is there anything that we could read into that? What's the latest theory?
There's nothing on the fact that it's just that the swabs are processed by the ESR lab here in Wellington.
Well, that was Dr. Ashley Bloomfield. If you'd like to continue watching that live stream, it is on our website, newshub.co.nz. But just to recap the latest case numbers, there are 9 new cases today, all in the community. 7 of those new cases are linked to the Auckland cluster, but there are still 4 cases in the community which do not have a clear link to the cluster yet. Those cases are still under investigation. 5 people are in hospital, 2 in Auckland and 3 in Middlemore. They are all from the Jet Park Hotel and are linked to the cluster. It takes the total number of active cases to 78, and 58 of those are from the Auckland cluster. Well, thank you very much for joining us this afternoon. I am Tom McRae. Have a good afternoon.